Childhood psychological disorders. This is the topic for the day. I'm Amir Mir. Let's begin. What are psychological disorders? Mental health is the overall wellness of how you think, regulate your feelings, and behave. A psychological disorder or mental health disorder is defined as patterns or changes in thinking, feeling, or behaving that cause distress or disrupt a person's ability to function. Mental health disorders in children are generally defined as delays or disruptions in developing age-appropriate thinking, behaviors, social skills, or regulation of emotions. These problems are distressing to children and disrupt their ability to function well at home, in school, or in other social situations. Barriers to treating childhood mental health disorders. It can be difficult to understand mental health disorders in children because normal childhood development is a process that involves change. Additionally, the symptoms of a disorder may differ depending on a child's age, and children may not be able to explain how they feel or why they are behaving a certain way. Concerns about the stigma associated with mental illness, the use of medications, and the cost or logistical challenges of treatment might also prevent parents from seeking care for a child who has a suspected mental illness. Common disorders among children. These are the common disorders that a child might have. Anxiety disorders, attention deficit or hyperactivity disorder, which is also called ADHD, autism spectrum disorder or ASD, eating disorders, depression and other mood disorders, post-traumatic stress disorders, PTSD. Now let's discuss each of these one by one. Anxiety disorders. Anxiety disorders in children are persistent fears, worries, or anxiety that disrupt their ability to participate in play, school, or typical age-appropriate social situations. Diagnoses include social anxiety, generalized anxiety, and obsessive-compulsive disorders. Attention deficit or hyperactivity disorder, also called ADHD in short. Compared with most children of the same age, children with ADHD have difficulty with attention, impulsive behaviors, hyperactivity, or some combination of these problems. Autism spectrum disorder, also called ASD for short. Autism spectrum disorder is a neurological condition that appears in early childhood, usually before age 3. Although the severity of ASD varies, a child with this disorder has difficulty communicating and interacting with others. Eating disorders. Eating disorders are defined as a preoccupation with an ideal body type, disordered thinking about weight and weight loss, and unsafe eating and dieting habits. Eating disorders such as anorexia nervosa, bulimia nervosa, and binge eating disorder can result in emotional and social dysfunction and life-threatening physical complications. Depression and other mood disorders. Depression is persistent feelings of sadness and loss of interest that disrupt a child's ability to function in school and interact with others. Bipolar disorder results in extreme mood swings between depression and extreme emotional or behavioral highs that may be unguarded, risky, or unsafe. Post-traumatic stress disorder, or PTSD in short. PTSD is prolonged emotional distress, anxiety, distressing memories, nightmares, and disruptive behaviors in response to violence, abuse, injury, or other traumatic events. This is all about the topic childhood psychological disorders. If you have any other questions, leave them in the comments below. Please like and subscribe to my channel. Thank you so much.